Good afternoon, everyone. I'm Dr. Stella Marie Jose. I am pitching in for Dr. Raymond Sarmiento, who is abroad at the moment. Welcome to the 231st episode of this webinar series, and thank you for being part of the credible online community. We could not have made it without all of you. And to all those who have just discovered us today, welcome po. The Philippines is currently experiencing a concerning surge in HIV infections, a trend demanding urgent attention and comprehensive understanding from all frontline healthcare professionals. In this week's episode, our esteemed speakers, who are board-certified OB-GYN specialists, will discuss the nuanced aspects of HIV transmission, focusing particularly on vulnerable populations and the unique challenges presented within the Philippine context. We will examine the latest statistical data highlighting the demographic shifts and risk factors contributing to this alarming increase. Our discussion will navigate intricacies of antiretroviral therapy initiation, adherence, and monitoring, empowering our attendees with the knowledge necessary for effective patient management. In addition, we will explore the critical role of pre-exposure prophylaxis and post-exposure prophylaxis in preventing HIV transmission, elucidating their appropriate utilization and accessibility. Understanding the clinical manifestations of HIV, particularly in the context of opportunistic infections, remain crucial for timely diagnosis and intervention. We will address the common comorbidities and complications associated with HIV, emphasizing the importance of multidisciplinary approach to patient care. We will also address the psychosocial dimensions of HIV, acknowledging the stigma and discrimination that continue to impede access to care and impact patient well-being. In celebration for the National Women's Month, we are putting on the spotlight one of the top infectious disease experts in the Philippines, Dr. Sibyl Lizan Bravo. Now, my counterpart is Dr. Feby De Ramos. Feby?
Hello, good afternoon, everybody. Good morning, good afternoon, good evening to everyone. So welcome to our participants here in the live broadcast of the Zoom webinar. I am your co-host, Dr. Feby De Ramos. So I'd also like to welcome all those watching via live streaming on TVUP YouTube channel, as well as UP System Facebook page, TVUP Facebook page, and TVUP Signal TV channel 101. So our panelists for today are Dr. Sibyl Lizan Bravo and Dr. Lorena Esteban. That's what you've mentioned, Dr. Estela. But our new program is now called Health Updates. We have done a little bit of reformatting for our program, but we are maintaining the same high quality and then leveling up to take a closer look at the existing and emerging health problems in the Philippines and the rest of the world. So for 2025, we want to get immediately to the heart of the discussion. And so our program is now shorter. So nonetheless, our speakers are experts in their chosen field. For today, we will delve on the topic of HIV. So back to you, Doc Stella.
To make it interesting for all of you, we have our person on the street video. Kaya namin ginagawa yung person on the street video because we want to know the pulse of the ordinary person. So yung what people think about HIV. Okay, so let's listen and watch the video.
I know that HIV has been a really pressing issue here in the Philippines, but regarding the specific statistics on how it's been increasing, how it's decreasing, or stable, hasn't been something that I've been aware of.
Actually, wala akong idea din sa pagtaas.
I'm very
very aware since ayun nga,
Can you
our recent
open the
times, mas
video now?
accessible yung HIV testing.
Yeah, so I'm actually aware that the HIV cases are rising. I have best friends who are part of the LGBTQ+.
There is a misconception rin with HIV testing prior. It's good na maraming tao na aware with yung HIV testing and such and such.
I think many of the calls regarding HIV is mainly on having more emphasis on it, on policies regarding having more awareness on it, on its effects, on its risks, and not downplaying what it can do and the importance of being able to know more about it. And
Kailangan siguro natin magbigay pa tayo ng warning about katulad sa social media about sa mga kabataan na nahihilig din sa ganyang sex or same-sex.
A proper sex education in the Philippines is very necessary, especially for teenagers, since aside from the rising number of cases of HIV, there is a rising number of teenage pregnancy in the Philippines.
I think one is really to start educating themselves, but of course, educating themselves is difficult if the resources are not available. So hopefully, like there will be like mga drives or where they spread these awareness, maybe social media campaigns that can really, parang make the communities educated, especially those na don't have access to internet.
or I'm not that aware or educated on that specific medicine.
Actually, wala din akong idea sa ganyan.
The use of PrEP, since I have friends who availed PrEP na rin before, and other means of contraceptives.
Yeah, so I'm aware of PrEP. So my best friends also like take it whenever they're having like dating around, when they date with other people, and they keep themselves protected by getting PrEP.
Yeah, definitely. I think I've heard of a few programs regarding free HIV testing and medicine. I think one of the main concerns that I've always been hearing alongside these programs is they're usually ineffective in being able to address the issue of HIV here in the country.
I'm aware of Likhaan Pilipinas, which is a non-profit organization who nagbibigay sila ng free HIV testing, free contraceptives.
Yeah, so I'm aware of Love Yourself Philippines. I think it's been advertised by Catriona Gray, if I remember correctly, and then there's a lot of like ads also about that. So that's the most famous one that I've heard of.
Yeah, so it seems some of our audience are already aware of that the kamukha ng PrEP, no, pre-exposure prophylaxis. Now, Dr. Feby will introduce our speaker.
Okay, so let us now proceed with the topic at hand for our webinar. So I'd like to introduce our main presenter for this afternoon. So she's Dr. Sybil Lizan Bravo, and she's a clinical associate professor and the chief of division of OB-GYN infectious diseases of the Department of Obstetrics and Gynecology of UP College of Medicine and Philippine General Hospital. She's also the president of Asia Oceania Research Organization in Genital Infections and Neoplasia of the Philippines. And she's the immediate past president of the Philippine Infectious Diseases Society for Obstetrics and Gynecology. So let's all welcome Dr. Bravo. The screen is yours.
Can we have the video, please?
Thank you for that kind introduction. As was mentioned, our topic for today is about HIV in the Philippines. Where are we now and what we can do? This will be an outline. We'll talk about some definitions, symptoms management, complications, what are we doing now to control the infection in the local setting. So we know that HIV is one of humanity's deadliest and most persistent epidemics. It stands for the Human immunodeficiency virus, that is a retrovirus that infects cells of the human immune system, mainly CD4 positive T cells and macrophages. There are two types, HIV-1 and 2. HIV-1 is the most common also in our country. So, as I've mentioned, it is an infection that attacks the immune system, specifically lowering the white blood cells called the CD4 cells. It weakens our immune system, and persons might be at risk of having opportunistic tuberculosis, fungal infections, other severe bacterial infections, or selected cancers. Now, we all know that since its discovery in the early 1980s, there's been no effective cure. And if not treated, HIV can lead to AIDS as acquired immunodeficiency syndrome. But with proper care and medical treatment, patients have now they're now with long lives, and of course, the infection can be controlled. People with HIV who get effective treatment can live long, healthy lives and protect their partners and their families. Now, taking a closer look at the situation in our country, so we are now dubbed as having the country with the highest prevalence of HIV in the Southeast Asia. As of current statistics in 2024, about 40 million people globally were infected with HIV, and about 1.3 million people become newly infected with HIV in year 2023. So it has been an epidemic no, since the 1980s, such that people living with HIV are now getting better access to antiretroviral therapy. What is alarming though is that in Southeast Asia, as I've mentioned, we are the country with the highest increase in prevalence for new infections, and AIDS-related deaths have been increasing in our country, whereas it has been reduced globally by about 69% since 2004. But in our country, as I've mentioned, the prevalence has been steadily increasing. So we will not know the impact of this unless we are comparing these prevalence rates with other countries. So while in Asia Pacific region, they have witnessed a 14% decrease in new infections. There's also parallel 51 decrease in AIDS-related death between 2010 and 2022. But in our country, as I've mentioned, we are continually seeing a rapid increase in new infections and AIDS-related deaths, such that there have been about more than 400% change in new infections since 2010 in our country. And alarmingly, there has been about 538% increase or change in AIDS-related deaths since 2010, or about 15 years ago no, in our country. So it's very, very alarming. With the latest HIV/AIDS surveillance from our DOH from last year, there have been estimates that we will have more than 215,000 Filipinos living with HIV. Again, this is very alarming because the numbers are growing and yet increasing and partly may be hidden. So the DH reported about more than 4,000 new cases in the last 3 months of last year. So that's from October to December. And on a monthly basis, we have been seeing about 1,000 to 1,500 new infections on a monthly basis. So this is very, very high as compared to other countries. Their prevalence rates are now decreasing. So one of the complications, as I mentioned earlier, of HIV is the chance for having opportunistic infections, one of which is having tuberculosis. And our country has been seeing ever increasing rise in new TB cases, and these are more among patients with HIV. So HIV has been more common among male population, specifically among the MSM and among transgender women. And the youth, again, remains the driver of new infections. So we really have to ramp up on testing and providing education among these high-risk groups. Now, let me share with you briefly our latest statistics at the UPPGH for OB-GYN IDS. This is a comparison for the past 5 years of the top 3 new OPD consults in our division of OB-IDS. So we see that even during the pandemic, HIV is among the top 3 reasons for OBD consults. And last year, it's number 2, no second only to hepatitis B, as the reason for new consult. And among our pregnant women, even during the pandemic, we have been seeing steadily increasing cases, number of cases. And in last year, we topped at around 42 new cases in 12 months. So that's average of 3 cases per month, 3 or more cases per month. So this is very, very alarming since during our fellowship, so that's more than 10 years ago, we have only been seeing around 1 to 2 cases in 3 months. But now we are seeing more than 3 to 4 cases on a monthly basis. So most of our patients who have HIV are in the age range of around 20 to 25, followed by our adolescents of 15 to 19 years of age. But most of them, for some good news, have undetectable viral load. This is due to the availability more of the antiretroviral agents. And as such, some of our women are able to deliver normally or vaginally. Now, for the neonatal outcomes, majority of our babies have good Adler scores and they are roomed in with the mothers and they go home with the mothers. And most of them are actually well baby, but some would still suffer from neonatal pneumonia. And with monitoring, some of these babies are classified under suspected HIV host or babies of infected mothers. Some also have co-infection with syphilis and hepatitis B. So these are all problems that, of course, we need to overcome. For the risk factors and symptoms, so we all know that as with other STDs, having multiple sexual partners is one of the most common risk factor for having or acquiring HPV, followed by unprotected anal vaginal sex, presence of other STDs such as chlamydia, gonorrhea, syphilis, herpes, sharing infected needles, receiving unsafe injections, and of course, it may also be passed through blood transfusion, but it's very, very rare now. And through accidental needle exposure, especially among healthcare workers. So most of the symptoms, our patients will suffer from fever, sore throats, night sweats, mouth sores, enlarged lymph nodes, rashes, chills, fatigue, or muscle aches. So there are different stages. So stage 1 means acute infection, means they have large amount of HIV, so there's viremia, and they would suffer from flu symptoms. Stage 2 means there's chronic infection. Patients might now be asymptomatic, but the HIV still replicates at a higher rate. Stage 3 is acquired immunodeficiency syndrome, wherein they get increasing numbers of severe illnesses, specifically opportunistic infections. They have low CD4 counts and high viral loads. And of course, this is our main goal for our patients who are in HIV stage, for them not to go into AIDS or stage 3. It's very important that we diagnose everyone, especially those at risk of acquiring infection. And every person at risk should have access to testing, and they should be able to seek comprehensive and effective prevention testing and therapy services. Well, many tests are available now, and these are available for free in most DOH laboratories or NGOs. But still, we need to follow the 5 C's, such as acquiring informed consent, maintaining confidentiality, bring them to counseling with correct results, and provision with connection with services if found to be positive. There are two algorithms for HIV testing, but what we are now practicing is the so-called WIVDA, or the new HIV confirmatory test, which consists of combination of three rapid diagnostic test formats done in parallel on in sequence. The new algorithm now bypasses the long wait for the Western blot assay, or the previously recommended PCR test for HIV. As such, we are now more able to diagnose the infection and offer treatment and preventive services to their partners and their families. Let me quickly share with you updates regarding HIV and pregnancy. Now, our main goal now is prevention or total elimination of maternal to child transmission through the following cascade services, such as offering antenatal testing, provision of antiretroviral agents for those found to be positive, offering safe labor and delivery techniques, safe infant feeding options such as breastfeeding, early infant diagnosis, and of course, linkage to care of both mother and child to treatment. What we're practicing is the opt-out approach, meaning we offer the test as part of the prenatal labs, but considering, of course, pre-test counseling and advice. So, to take out the stigma on HIV testing, we should be able to talk about HIV testing freely in a non-defensive manner, but being proactive in terms of counseling and giving the advantages of testing as opposed to the open approach. And of course, we never practice mandatory testing yet in our country. From the current CDC guidelines as well as our own local POGS and PIDSOG handbook, we highly advocate offering the test during the first prenatal visit, and for those found to be negative but at risk of acquiring infection throughout the gestation, we have to repeat the test at 34 to 36 weeks, so that's essentially before delivery, in order to increase detection of HIV among these high-risk groups and offer, of course, treatment and further prevention of maternal to child transmission. So our role as OB-GYN is that we handle all HIV positive patients from prenatal care to delivery and during the postpartum care, and we also handle gynecologic positive patients. So with the advent of the presence of the ARV and adequate monitoring for the viral load, we are now able to offer normal delivery to our patients, especially for those maintained on ARVs before delivery with very low viral loads, and of course, for those with no absolute content, well, rather indication for desired delivery. As well as we are now highly advocating exclusive breastfeeding among mother-baby dyads, because studies have shown that exclusive breastfeeding is still the best feeding option for the infant of HIV-infected mothers. Now, for the management, of course, treatment depends on the stage and presence of opportunistic infections. Our main goal is prevention of course, immune deterioration with use of triple or multiple highly active antiretroviral therapy. We also offer prophylactic agents against opportunistic infections, and the goal now is to make them understand that once diagnosed, they have to be maintained on ARVs for life. So that's essentially to increase or to maintain the good enough CD4 counts and prevent AIDS-defining illness, specifically hepatic and cardiovascular complications. So from the latest WHO guidelines, these are available since 2021. I'm not here to discuss the particular agents, but suffice to say that with successful, again, maintenance with antiretroviral therapy, viral suppression is maintained in more than 90% of patients that would prevent transmission to their partners and their families. And our goal is, of course, viral suppression to the point that their viral load is undetectable or suppressed. So more or less in our country, that's viral load of less than or equal to 1,000 internal copies per ml. So we need also to monitor response to treatment, because this is one of the successes in prolongation of life in these patients. So there should be routine viral monitoring. So the viral load count should be determined at baseline of at initiation of therapy. then after 6 months, and ideally yearly or 12 months or every 12 months or after. So for the CD4 count, there should be also baseline count. But if they are virologically suppressed, we could stop monitoring for their CD4 count. Well, for some good news, the viral load count and the CD4 count testing are now covered by PhilHealth. So essentially, one of our main goals in offering treatment to these patients is prevention of the following complications. So a number of these conditions include cardiovascular diseases and non-AIDS related cancers, bone disease, diabetes, bone fractures, liver disease, lung disease, renal disease, and of course, cognitive decline. But with continued use of ARVs, these complications can be prevented. Other complications that we need to prevent are wasting syndrome, that's defined as unintentional loss of more than 10% of body weight that manifests with fever, diarrhea, and anorexia. And we also need to advise them against cervical cancer. So with continued lifestyle modification and HPV vaccination, most of this can be prevented. We also need to advise them against the possibility of them having non-Hodgkin's as well as Hodgkin's lymphoma. And as such, they have to be maintained on continuous ARV to possibly prevent these complications. What are all the strategies to reduce non-AIDS events or complications? Of course, the key to having successful management of these patients is early initiation of treatment and treatment of inflammation and prevention of immune activation. They should be stopping smoking, alcohol beverage intake, and screen for other metabolic and cardiovascular diseases. They should be maintaining on healthy lifestyles such as exercise, healthy diet, use of aspirin, and possibly lipid-lowering agents. So on June of 2021, the United Nations member states adopted a political declaration calling on countries to adopt the so-called 95-95-95 targets to end the AIDS pandemic, hopefully by 2030. So it's just 5 years from now, and hopefully we're among one of the countries that could be successfully adopting this. So the declaration ensures that hopefully more than 95% of people living with AIDS or HIV should know their status. The second 95 means 95% of people who know their status should be receiving continuously their treatment or ARVs. And 95% of people on treatment should be virologically suppressed. So incorporating additional priorities such as meeting women's needs for HIV and sexual and reproductive health services. And this would also entail promoting person-centered combination prevention for people living with AIDS and those affected by HIV, and adopting an integrated approach to well-being and healthcare, and addressing the more important social and legal barriers that would limit access and use of HIV services. So maintaining them on ARV for a lifetime reduces the likelihood that these patients will develop pathologies such as the complications as we have detailed earlier, and preventing transmission to the sexual partners, and of course for those who are in the reproductive age, eliminating maternal to child transmission. So hopefully with this 95-95-95 target, our own country can avert around more than 160,000 new infections by year 2030. So where are we now? What are we doing now? As I've mentioned, the DOH applies this 95-95-95 target, and we should be ending AIDS-related death by year 2030. Again, that's just 5 years from now. Hopefully, working hand in hand, we can prevent this. So how can we achieve this? Well, we should be providing adequate education to those who are at risk. So these are the so-called populations that are at risk for acquiring HIV, primarily those who are MSM or those who are male having sex with male, because as from the latest statistics, more than 89% of new infections are among this population. We also should be providing education among those people practicing injection drug use, although again, this is taboo in our country because providing them new needles and syringe would be against our Comprehensive Dangerous Drug Act, as in some countries, they are more open to provision of fresh or new syringe supply of syringe and needles to those who are injecting drug use. But in our country, we know that these people no, are well hiding no from the law, and as such, we cannot yet apply this very effective strategy. So hopefully, we will be more open no, to providing education to these people. So we should also be providing adequate testing, especially to this at-risk population. So many NGOs now are offering free services for testing. And again, migrant workers, people who are in commercial sex business, or especially we should be identifying people who are trafficked for sex or people who are deprived of liberty should be offered free testing. And we should be abolishing the stigma that goes with HIV testing. Next is ABCs of HIV prevention. So we should be able to provide education that abstinence is the best way to prevent HIV transmission. And well, we should all be faithful, no? So being faithful or monogamous relationship is one of the key strategies. And C stands for condom use. So barrier method of STI prevention is of utmost importance in preventing HIV transmission. We should also be educating everyone regarding the availability of pre-exposure prophylaxis and increased testing services and treatment as prevention. Next is, of course, we should be eliminating the stigma associated with testing and HIV disease. So stigma is defined as an attribute causing people to be perceived as less or shame, and it can be enacted to various forms of discrimination. We should be mindful of the intersecting social determinants of health as crucial in tackling health issues, especially those with overlapping behaviors that put them at high risk of HIV, especially with key populations among male having sex with males or those engaged in commercial sex work. So when a world leader talks about there being only two gender assignments as male and female gender at birth only, this would potentially eliminate the LGBTQ plus community, who in turn might suffer from further stigma, making them not wanting to have STI testing and treatment. And again, this might further increase transmission of HIV. So what do we do now? We should be freely talking about HIV, and with this strategy, we can help normalize the subject and can provide opportunities to correct misconceptions and help others, especially their families, learn about the disease. But we should always be mindful of how we talk about HIV and people with this infection. Next is about HIV counseling and testing. In our country, testing remains focused among pregnant individuals and those who are at high risk, especially those with co-infections such as tuberculosis and other STIs, key populations, and their partners. Now, we should be able to bust the barriers to HIV testing among Filipinos, including the stigma related to testing, as I mentioned earlier, the misconceptions about the virus, fear of testing positive for the disease, and of course, financial instability. So what do we do now? We should be adopting HIV self-testing, and we should be starting social networking and index testing, so that's partner notification. And we expanded Act in 2018, that's the RA 8504, we should be able to apply the expanded HIV testing to include provider-initiated counseling and testing. So this means allowing more licensed social workers and health service providers to provide free HIV testing to more Filipinos. The new RA law also allows testing among adolescents aged 15 to 17 without parental consent. So this would now expand testing even to these adolescents, because we know that adolescents are now the main drivers of new HIV infections. And again, we have started to adopt the rapid HIV diagnostic algorithm, the RIVDA, which consists of 3 rapid tests to diagnose or confirm the infection. So this would now lessen the time for giving the confirmatory HIV diagnosis. And of course, doing so, we'll be able to detect more new infections and offer of course, treatment and preventive services to their partners and their families. We also now educate everyone, especially those at risk populations, of the availability of the so-called PrEP, so the pre-exposure prophylaxis, which is the use of combination ARVs that is indicated for people who are HIV seronegative, but they are at substantial risk of having HIV. So these are for people who are still negative for the disease, but their partners are HIV positive. So there are different modes of taking PrEP. So the main thing now is we should be able to provide enough education to this at-risk population regarding the availability. In some centers or NGOs, these are given out for free, but they're also available at selected drugstores. But this would cost around 1,500 pesos per bottle. So the dosage is very, very simple. A person takes 2 pills, 2 to 24 hours before exposure. Then he or she takes 1 pill 24 hours after the first dose and 1 pill after this second dose. It's very, very simple. There's also the availability of the so-called PEP or the post-exposure prophylaxis. So if you are exposed to HIV, you may take this as soon as possible within 72 hours or 3 days from exposure. So the Philippine Health Sector HIV Strategic Plan aimed to expand PEP even to non-healthcare related exposures. So another strategy is, of course, offering treatment and care delivery. As we have mentioned, most of these ARVs are still available for free, and our government has started providing this for free with the single dose formulation of TDF. So that's lamivudine, dolutegravir, and tenofovir. So it's very, very simple to take. They just have to take in once a day, 1 pill or 1 tablet. It's swallowable. That's highly acceptable among our patients. This would increase compliance to therapy. And we should be able to monitor for co-infections, for opportunistic infections such as tuberculosis and other STDs. And we should be able to educate everyone about the principle of U equals U. So undetectable means untransmissible, which is, of course, one of our main goals in providing therapy to our patients. Another care delivery is that our government started to recommend triple screening among pregnant women for HIV, syphilis, and hepatitis B since almost, 10 years ago or 1 decade ago. And this has been expanded not to be provided for free in most NGOs or local health units. So it's very crucial to ensure continuity of standard of care across all components in order to prevent or eliminate maternal to child transmission, especially of HIV. Now, we have heard news in January of this year that United States of America will be closing the US aid which includes provision of free ARV drugs to resource limited settings, including our country. But from the Presidential Communications Office, they have said that the shutting down of US aid will not really affect delivery and availability of our ARVs because we still have enough supply. And the temporary closure of the US aid is just for 3 months. So it might end this March or April, and the US aid still might continue to provide care services, including provision of free drugs to our country. But again, our government can always ask other foreign development partners for assistance. But as I've mentioned, as of now, we still have enough supply of ARV. So this has been one of the debates that we are talking about. Because if we lack ARV, then again, this would mean increase again. So another increase in new rates, or rather new cases of HIV, and increased transmission possibly among our countrymen. Of course, we do not want this. Additionally, again, we should be able to monitor response to treatment, including genotyping testing and resistance testing. So for some good news, we have already achieved 63%, 65%, and 95% of the 95-95-95 goal of WHO. So As of now, among our MSM, there is about 98% viral suppression rate because of the availability of ARVs. And as such, of course, we need to continue to provide these drugs for free to positive Filipinos. But again, with the looming problem that the USAID will stop provision, we have to outsource for availability of these drugs, probably from other resource-rich countries. Now, viral load testing is not routinely done because of increasing costs, but again, we need to facilitate integration of these services to prevent other complications such as the transmission of opportunistic infection. We should also be able to provide or to do resistant testing and genotype testing, and we should be able to continue our efforts with regard to these types of laboratory provision. So we have detected resistant strains of HIV type 1, and as such, there should be an impetus for various stakeholders to further ramp up HIV testing treatment and to include resistant testing in our country. So these are the following key points of my lecture. We should be able to take out the stigma of HIV infection and testing. We should be able to provide education about STDs, including HIV, and increase testing capacity. We should also find out other sources of funding for the availability of HIV drugs or antiretroviral agents. And we should be able to maintain monitoring capabilities for treatment response and educate everyone about the availability of pre-exposure prophylaxis and post-exposure prophylaxis. Now we have expanded with the confirmatory laboratories nationwide. So we just need to tell and educate our patients, their families about the free testing that are already available nationwide. We could also offer telemedicine, especially for those who are affected with stigma of testing, and increase ARV delivery services and access points, especially to rural areas. We should be able to have high impact intervention testing and treatment strategies, ramp up on condom use, differentiated HIV testing like social and sexual network testing, and scale up of treatment facilities and viral load laboratories. So achieving the HIV health sector plan, so that's achieving the 95% goal by 2030, really needs a massive scale up. And of course, it needs the participation of the government sector, community efforts, LGUs, and international partners, and civil service sectors to, of course, reverse the HIV epidemic in our country. We all know that HIV is the virus that attacks the body's immune system, but it is highly preventable through education and prevention by testing and provision of these other services. Thank you very much for your attention.
That's a very important lecture from Dr. Sibyl Bravo. No, I hope our audience appreciate the statements that she gave out. No, and for those of you, you can watch this again. We have a recording of this. Feby, you want to say something?
Yes, I agree, Ma'am Stella, with all your comments. I hope all our audience learn from that lecture. So we can already introduce our next speaker, our reactor. I'd like to welcome in the virtual floor our reactor. She's a fellow of the Philippine Infectious Diseases Society for Obstetrics and Gynecology, as well as a consultant of the Division of OB-GYN Infectious Diseases of the Department of Obstetrics and Gynecology. I'd like to welcome Dr. Lorena Esteban. Good afternoon, Ma'am Lori.
Hello, good afternoon. I have a few things to say, Ma'am. Dr. Sibyl Bravo has discussed most of the facts we should know about HIV. So just to like summarize, the WHO 95-95-95-23 goal is almost near, no? It's just within 5 years. And the goal is to eliminate AIDS pandemic. And to do that, first, we need to screen. Second, we need to treat those who are found to be HIV positive. And then prevent HIV transmission, either to the partner or from mother to child transmission. And I agree with Dr. Bravo, the stigma with screening should be eliminated, and there should be more competent and well-trained HIV counselors in majority of our healthcare facilities, because a lot of patients are undetected, meaning they do not have themselves screened. And screening will help definitely in curbing the increasing rise of HIV cases in the Philippines. Now, to screen, the introduction of the RIVDA testing since 2019 helps us diagnose HIV patients faster here in the Philippines. Before there was a two-step procedure in diagnosing patients. So first, we do the antibody test, and if it's positive, we repeat it. And then if the two antibody tests are positive, we send pa the specimen to San Lazaro for confirmatory test, the Western blot, which can take 1 to 3 months before we confirm that the patient has HIV. Now, with the RIVDA algorithm testing, we can diagnose these patients faster, no, and treat them earlier. So the increase in the number of RIVDA facilities in our country, before there were just 38 facilities. Now, I think, or by 2022, there have been 68 facilities offering the RIVDA testing in the Philippines, no? And again, once identified, HIV positive patients will be screened, and those who will need antiretroviral therapy, no, will be managed in the HIV treatment hubs, again, located in many parts of the Philippines. Now we have 180 HIV treatment hubs all over the country. Okay. Dr. Sibyl mentioned about the regimen. So the current regimen that we are using now is the TLD regimen. This is very effective. There are low resistance rates to this regimen. And the goal is to have a patient take the medication consistently, because this would definitely lower down their HIV viral load. And there's this concept of HIV undetectable and untransmittable concept, which means that when an HIV patient takes her medication and this patient maintains an undetectable viral load, or viral load less than 1,000 or less than 50, these patients cannot transmit the virus to their partner. These patients cannot transmit the virus to their babies, no? So adherence to the antiretroviral therapy is key also in achieving the end of AIDS pandemic in the world. So aside from ART, so Ma'am Sibyl also introduced the pre-exposure and post-exposure prophylaxis. And there are NGOs in the Philippines who are providing the medications for pre- and post-exposure prophylaxis. Again, this will also curb the increasing rise of incidence of HIV in the Philippines. Okay, once diagnosed, a patient would need a support group, no? There are support groups in the Philippines who are there to guide people living with HIV. So notable in the Philippines, we have the PAFP, or the Positive Action Foundation Philippines Incorporated, the Love Yourself, as mentioned by one of the students by who was interviewed earlier, and the AIDS Foundation for South Africa. So these NGOs provide free HIV screening, they provide counseling, and sometimes they also help patients with their financial needs, no? Financial needs. Yun. That's all for my reaction to Ma'am Sibyl's lecture. Thank you.
Thank you very much, Dr. Lori, for your comments. I just have a question, no? Kasi when you breastfeed a baby, I think we also have to emphasize that the mother must not have lesions, no? Ay, wala siya mga cracks in the nipple. Kasi when she's going to breastfeed the baby, tapos HIV positive siya, syempre matatransmit nung sa baby. Tama
Yes.
ba ako, Lori?
Yes, ma'am, agree. But as long, ma'am, as the mother has very low viral load,
Viral
oh
load.
yeah, there's also no chance of transmitting the virus to the baby.
Yes, thank you for that. You have questions, Feby?
Yes, hello, good evening. I had some technical difficulties, but I hope everybody can still hear me. There are some questions in the chat box, but one of this is about the HIV study. If hopefully we can provide a vaccine soon, what can we say about it, Ma'am Laurie?
Oh, the research on the development of an HIV vaccine has been going on for years, no? For years, they've been trying to formulate a vaccine against HIV. However, this has been very challenging. So researchers have been trying to make one, but the problem is the HIV replicates very quickly. And then there are genetic mutations that are very constant and making it difficult now to create a vaccine that can recognize and neutralize the different strains of the virus. So they are doing it, but very difficult. Hanggang ngayon po, wala. So what we are doing now is treating the patients so that their immune system will be boosted. They will be protected against opportunistic infections. But as of now, yan, mahirap pa po. Wala pa pong nakakagawa ng vaccine for HIV. And then,
So, yes.
it also targets kasi CD4 cells. CD4 cells are part of our immune system, no? So, isa po sa problem yon. If it's part of the immune system, the virus evades the adaptive immune system in the body, again, making it difficult for the body to fight this virus.
So I hope that was very well explained by Dr. Esteban. I think that was Dr. Joseph Tortona who asked that question. So I'd like to just give the shout out for all those who watched us. No, so we have from the University of Hail, Saudi Arabia. We have visitors from Chonin Hospital, Taipei City, Taiwan. Ryan Hall, Shanex Incorporated, Bridgewater, Canada. We have from the Bicol Region General Hospital and Geriatric Medical Center, Cabusao, Camarines Sur, Cagayan Valley Medical Center, Tuguegarao, Cagayan. We have also visitors from Batangas Medical Center and Pumintang, Ibaba, Batangas, and University of the Cordilleras, Baguio, Benguet, and from the West Visayas State University Medical Center, Iloilo City, Iloilo. Thank you for watching our program. I think the next part is our yung ating excuse me, wait. So we have our panel evaluation. Can we
Yes.
post that now? Our panel evaluation. Yeah. Okay, so the audience will rate our panelists. So number one, the panelists demonstrated thorough knowledge of the topic. Okay. And then the panelists were well prepared and organized. That's the second criteria. And the third is the panelists spoke clearly and audibly. And fourth, the panelists use appropriate language with technical medical jargons adequately explained. And lastly, the panelists contributed to new perspectives and knowledge in managing various key health issues. So for our audience, please answer the poll. And we'd like to thank our speakers, Dr. Sibyl Lizan Bravo and Dr. Lorena Esteban, for their very enlightening lecture. And this will be shown up to next week, the whole week, from Luzon, Visayas, and Mindanao, the recording of this lecture. And everybody can watch it again. There are many learnings from the lectures, and I hope we support our TVUP. And for next week, our topic is on education. The speaker is Dr. Florida Taladtad. or Apple. We call her Apple. And the topic is gross anatomy, the teaching of gross anatomy in the present time. Okay. I think we will now go to our meron pa kasi kami mga ads, tong mga SED shorts and the other ads that we have. Ton, can you show it now, please? Ayan. So, these are the episodes that we have. So, we are already in the 231st episode. And if you like to visit the other webinars, you can just log in and at youtube.com/tvupph. And you can watch all any of the um, the episodes that we have. We also have the SED shorts. Yung SED shorts, they are short updates, no? So if you're in a hurry, you're just waiting for your bus, you can look this up. Again, at youtube.com/tvupph. I think that's the end of our webinar for today. And our next week, as I mentioned, we have Dr. Florida Talentad as our main speaker, and also Dr. Pipo Bondok as her reactor. Thank you very much to our audience, and thank you very much to Lori Esteban and Feby De Ramos for joining us today. And we can assure you, everyone, that we will make our best effort to give you the best in best quality and education about these topics. I think this ends our program. Feby, you want to say your last words?
Yeah, so thank you to all our participants, most especially, of course, to our speakers and reactors. Thank you for TVUP. So congratulations, everybody. So together, we can stop preventable deaths. So thank you.
Stay safe, be healthy, and see you online. Thank you, everyone.